I just want to touch on a couple other small concepts the video will kind of breeze past. But one thing they say to do before administering anything through either a gastrostomy tube or a nasogastric tube is that we're going to be checking for residual volumes of the enteral feeding. And what that means is before I hook up and pump a bunch of food into their stomach, liquid food, I need to know, is there already a bunch of liquid food sitting in their stomach because it's not being digested or there's some obstruction somewhere. So before I start the next batch, I need to see if the old batch is still sitting in there. So what we do is we literally use this same irrigation kit. We take an empty syringe and we're going to be attaching it to either of these tubes, depending on which tube your patient has. They're not going to have both usually. But what I'm going to do with my empty syringe, I usually get a little bit of air. It just helps with getting the flow of fluid to move. Is I'm going to, oops, sorry, I need gloves. Because my paper patient has some gross stuff I don't want to get, on me. All right. And I have a blue kind of chuck pad we call here, a towel, something, because this gets messy, so have something to protect the bedding and the patient's gown. But I'm going to open this port. Now, remember, the pressure inside the body is greater than outside, so when we open a valve or a doorway, basically stuff can push out. So before I open the little plug on the end of this, I'm going to bend the tubing with one hand so that stuff doesn't squirt back at me. It'll happen, you'll see. All right, and then I'm going to open the plug. I'm going to attach my syringe with just a little bit of air at the end. Well, there's a little bit of fluid in there. All right, we'll get that fluid out. Just a little bit of air. I'm going to attach it. And I'm going to just push a little bit of air in the tube just to kind of move stuff along. And then I'm going to pull back and I'm going to withdraw. And as soon as, if the patient has stuff sitting there, as soon as I start seeing it fill the syringe, I'm just going to keep pulling back and pulling back and pulling back. If I fill this entire 60 ml syringe, I'm going to bend this tube, put the plug back in. I'm going to make sure this is empty, and I'm going to take the food that I just pulled out of their stomach and I'm going to push it into this empty container and set it aside. And I'm going to attach it, and I'm going to do it again, and I'm going to keep doing it until nothing comes out. And then I'm going to look at this and go, holy moly, 450 mLs came back out. That's not good. That means that the food is not moving along their gastrointestinal tract. So we're not going to give you specific numbers because each hospital has a different policy on the volume that they want you to then not give to the patient anymore, or we say hold it. They hold the feedings. If everything's sitting still and not moving, we hold the feedings. We alert the provider because something's not right, whether it's something mechanical with the patient, whether it's the tube feeding that is not agreeing with their system and it's just not processing. Something's not right. But typically, for most people, you're not going to see a huge volume. If I pull out 50 mLs and that's it, and I keep pulling, nothing else is coming back, you can stop trying to pull. If it's full, it's going to come out easily. So let's say I pulled out 50 mLs and this is filled with stomach contents and nothing else comes out. Well, I'm all right with that. That's not too much. What I'm going to do is attach this back, bend my tube, attach the syringe, and I'm going to push that 50 mLs of stomach contents back into their stomach. And I swear I heard somebody go, ew, yeah. And then plug that back up because that's part of our assessing for gastric residual volumes. All right.